Today, we're going to be talking about microbiology, and this is on chapter 10, which starts on page 186 of your dental assisting textbook. So we'll first go over some of the learning objectives that we'll go over, and it's first to identify some of the major contributors to microbiology, also to explain the groups of microorganisms and staining procedures used to identify them. We'll identify the characteristics pertaining to bacteria, protozoa, rickettsia, yeasts and molds, and to viruses. We'll describe the diseases of major concern to the dental assistant and explain why they cause concern. And we'll identify how the body fights disease. There are several individuals who made contributions to the field of microbiology. Uh, Anton van Leeuwenhoek, sorry, um, used a magnifying glass and he saw microorganisms from teeth for the first time. He is accredited with helping to develop the microscope. Ferdinand Julius Kohn classified bacteria as plants and divided bacteria into four groups. Each of these contributors made an impact on the approach to the identification and treatment of diseases. Louis Pasteur found that bacteria can be destroyed by heat. Through his early work, the food canning process was developed, and we used a process of pasteurization, which is the process of removing bacteria. He proved that bacteria causes diseases. In dental offices, sterilizers are based on the premise that heat will destroy or pathogens. His later work involved the foundation for many vaccines that are now produced. Just as Anton van Leeuwenhoek, Louis Pasteur was given the title of Father of Microbiology. So they are both known as the fathers of microbiology. Robert Koch came up with a procedure known as Koch's postulates. And basically, when a specific type of bacteria causes a specific disease, it is termed the etiologic agent. And Robert Koch proved that there is a causative agent of his disease. He found that etiologic agent for tuberculosis, for example. The Koch's postulates is a procedure developed to prove that bacterium was the cause of the disease. And if it was going to be determined that that certain bacteria caused the disease, that bacteria had to be present in all cases of the disease, or in all cases where people had the disease. It had to be isolated in a pure culture, and it had to be capable of producing diseases in other people or in other animals, and then again recovered from those people or animals and isolated in a pure culture. Richard Julius Petrie was an assistant to Robert Koch. While assisting, he noticed the need to develop a method to easily culture bacteria for research. He developed a cylindrical shallow dish with a lid that can be easily removed. This dish, known as a Petri dish, is used in labs today. He also further developed the technique for dispensing bacteria onto the medium. Bacteria and viruses have different characteristics, shapes, and sizes. To further distinguish the different bacteria groups, Dr. Christian Graham developed a staining procedure. This procedure differentiates cells into two specific groups, and they can either be gram positive, in which case they keep their dark purple color and a certain stain that is used, or they're gram negative, in which they'll lose their color. If it is a variable, if it is a variable stain, that means that there is both gram positive and gram negative cultures, and it is not a pure culture. Bacteria can be formed and it can grow with or without oxygen. Bacteria that have the need for oxygen are called aerobic bacteria. And we can think of this as when we do aerobic exercises, we need oxygen to be able to do that. So aerobic bacteria must have oxygen to grow and live. Anaerobic bacteria means that they do not need oxygen, and in fact, oxygen is toxic to them and can be destroyed in the presence of oxygen. Facultative anaerobic bacteria can grow with or without oxygen present. Also, there are the shape of bacteria that is unique to this group of microorganism. Under a microscope, the types of microorganisms are either bacilli, in which they are rod-shaped, cocci, in which they are round or bead-shaped, or spirilla or spirochetes, in which they are S-shaped, and vibrios means that they are curved like a comma. Tuberculosis is a disease in which bacteria can be found in the lungs. Some common symptoms of tuberculosis include fatigue, fever loss, and a persistent cough. If you ever watched the movie Tombstone, if you remember, Doc Holliday had tuberculosis and he was always coughing up blood. He ended up dying from that. And tuberculosis is an airborne disease, and which is why dental professionals must wear masks. Signs of tuberculosis may not show up for several months. And again, it is caused or it is found in the lungs and is caused by a mycobacterium tuberculosis. So the reason why dental professionals must wear masks is because they have to protect themselves from things that we use in the dental office, such as the spray that comes from the dental handpiece, which is another name for the dental drill. Also, hygienists use certain instruments that kicked up they aerosolize water, and they can also aerosolize bacteria and viruses while they're doing that. Tuberculosis is detected by skin test or a chest X-ray. Treatment for this disease is normally antibiotics or other drugs. Legionellosis or Legionnaire's disease obtained its name in the 70s when a large outbreak took place at an American Legion convention in Bellevue, Stratford. This disease is caused by a gram-negative aerobic bacteria belonging to the genus Legionella. The majority of the cases are caused by Legionella pneumophila, which is an aquatic organism that thrives in temperatures between 55 and 75 degrees Celsius. It is transmitted through droplets that contain the bacteria, and it is often associated with hotels, hospitals, and cruise ships that may have old cooling systems. Diphtheria and pertussis are other infections that can happen. Diphtheria is a severe throat infection, also characterized by fever. And a pertussis is a respiratory disease that mainly affects infants and young children. Tetanus is a stiffness of the jaw. A lot of people think of this as lockjaw, and that term may be a little bit deceiving because it's not often that the person experiencing tetanus will have a jaw that is completely locked. It could just be that stiffness that is coined lockjaw. And I just wanted to note that diphtheria, pertussis, also known as a whooping cough, and tetanus are all caused by a bacterium microorganism. All three diseases are prevented with the DPT immunization, which is a combined vaccination. An immunization is given to children at ages 6 months, 2, and 4 years. Tetanus boosters are given every 10 years after 5, or 10 years after the age of 5. Strep throat is very common. It's a very common disease that is characterized by a very severe sore throat, People with strep throat can get fever and just a general feeling of not being well. Strep throat is caused by the Streptococcus microorganism, which is a species of Streptococcus called Streptococcus mutans, and it has actually been implicated or connected in dental caries and endocarditis. A prophylactic regimen is recommended by the ADA for procedures that may cause endocarditis. So if a person has some type of surgical implant placed, or they have a prosthetic knee, or they have a prosthetic limb, or something that is in their body that is foreign, it is recommended that they have a prophylaxis treatment 1 hour before the procedure, which is usually a dose of moxicillin. This will prevent bacteria from adhering to um, whatever's inside of their body. And that bacteria can actually grow and get into the bloodstream and cause major heart problems. Staphylococcus infections are bacteria groups that grow in clusters. The first line of treatment is antibiotics. And infection groups include staph infection, gangrene, toxic shock syndrome, venereal diseases, and some forms of pneumonia. Anthrax is a disease that humans can get through cuts in their skin or eating diseased meat. It is in the powder form, and symptoms usually come within 1 to 6 days of exposure. Symptoms that do come or that are experienced include fever, weakness, and a dry hacking cough. It can be prevented by vaccination or antibiotic treatment before symptoms. And usually it's a select group of people that are prone to exposure of anthrax that are vaccinated. Chlamydia are microorganisms somewhere between bacteria and viruses in regards to their size. Um, they can affect or infect the genital areas, the eyes, and the lymph nodes. They are most commonly a sexual transmitted disease in the US, and treatment includes antibiotics such as tetracycline or erythromycin. Chlamydia trachomatis is responsible for these type of infections. MRSA is a bacteria that is resistant to commonly used antibiotics. It is passed by direct contact, and some people may carry MRSA but have no signs of the disease. So just a quick check. Some of the bacterial diseases and the shapes of them, just going over them one more time. Bacilli are usually rod-shaped. Cocci are usually round or beaded shaped. Spirilla are S-shaped, and Vibrios are curve-shaped. You may want to remember this as this may be on a test. Protozoa are just below the visibility of a naked eye. They are often called amoebas, and these microorganisms are 100 microns in size. The amoeba protozoa reproduce by binary fission and can be found in fluids in the bloodstream, mouth, intestinal tract, and survive in polluted water in pools and ponds. Many of them have flagella that whip around and cause additional movement, which is how they get around. Amoebic dysentery is an infection caused by the microorganism Entamoeba histolytica. In order to effectively kill the parasite, drug treatment is necessary. And amoebic dysentery can cause severe diarrhea and can even cause abscesses that develop in the liver. This is usually prevalent in countries where drinking water is contaminated and poor hygiene conditions prevail. Periodontal disease is caused by a combination of protozoa and bacteria. They are both found in inflamed tissue and around the tooth. Protozoa is found in plaque and periodontal pockets around the tooth, And treatments include removal or mechanical removal, which means cleaning of the plaque and tissue, and oral hygiene maintenance. Protozoa, again, in combination with bacteria, is the cause of periodontal disease. It is the responsibility of the dental professionals to educate and stress the importance of oral hygiene maintenance. Two other diseases caused by protozoa are malaria and sleeping sickness. Malaria is spread by the bites of mosquitoes, and sleeping sickness is spread by the bites of the tsetse fly. In order to kill the parasites in the blood, drug therapy is required. And some symptoms of malaria usually come in the first 2 weeks, and they include fever and soreness at the point of entry. Rickettsia are parasites that can't live outside the host. So, since they can't live outside the host, they usually infect small insects such as lice, fleas, ticks, and mites that can transmit the disease to humans. One of these rickettsia is head lice, and it's common among children in schools, and it's transmitted easily through direct contact. They can produce eggs in their and hair shafts. And lice are parasites that are tiny, blood-sucking, and wingless, that can also transmit disease through direct contact. When infected with head lice, it's called pediculosis. Some of the treatments include medicated shampoo and cleaning the bedding, brushes that the patient uses, and clothing with very hot water. Rocky Mountain spotted fever is a rare but curable disease, and its characteristics are small pink dots on the skin. Both Rocky Mounted and spotted fever are spread by a host and are treated with antibiotics. Typhus is another rare but curable or treatable disease. It can cause severe headaches, back and limb pain, constipation, rash, and confusion. Um, this again can be caused, or excuse me, it can be treated by antibiotics. Yeast and molds include bread yeast, mushrooms, and bread molds. This group of microorganisms are smaller than protozoa, but larger than bacteria. They are a low form of plant life that lacks chlorophyll, and they produce by budding. They cannot be killed by bacteria antibiotics because those are made from mold, but they don't act on mold. Candidiasis is a type of infection that is caused by a fungus called Candida albicans. The infection is called either thrush or monoliasis, depending on the area that it's infected. Um, this fungus is kept at bay by the normal flora in the mouth. However, when the normal flora is compromised either by the body's immune system or destroyed by antibiotics, the fungi will multiply and overgrow. So it is covered by mucus in areas such as the inside of the mouth or the vaginal area. And it can be treated by certain other forms of antibiotics. Tinea is a common fungal infection acquired from other infected people, animals, or inanimate objects, such as a shower stall. The appearance is named according to the site that is infected. For example, Tinea pedis is also known as athlete's foot. Tinea corpus is ringworms that can be acquired either by wrestling mats or yoga mats that are unclean. And Tinea unguium um, causes white patches on toes or fingernails, and it is often difficult to treat because of the location which is usually embedded underneath the fingernail that is not usually exposed to the environment. Prions are the host protein that convert normal protein molecules into abnormal structures. These abnormal structures are responsible for diseases classified as transmissible spongiform encephalopathy, otherwise known as TSEs. The TSEs affect the brain tissue, and mad cow disease or bovine spongiform encephalopathy, otherwise known as BSE, will affect the nerve cells of that individual cow, which leads to the loss of brain function. With only about 200 cases a year in America, Creutzfeldt-Jakob disease is fatal due to neurological deterioration. It is believed that this disease is related to prion proteins. Viruses must live inside hosts. There are 1/100th of the size of bacteria, so they're very, very small. They cannot be killed by antibiotics, and the treatment is usually to treat the symptoms of viruses, just because viruses kind of have to run their course. It's it's the job of the body's immune system to fight off these viruses naturally. And although there are some um, antivirals that can be taken for some diseases, most diseases there is no cure for, and we simply have to let the body take care of it. Some diseases that are caused by viruses include measles and mumps. Measles can cause rash and a fever and are spread by airborne droplets of nasal secretions. Mumps is a swelling of the parotid glands, which is a salivary gland on one or both sides. And somebody that has mumps will usually look like they have golf balls or like chipmunks, where their cheeks are severely swollen. It's usually spread by airborne droplets. With both measles and mumps, there is about a 9 to 11 day incubation period before the symptoms surface. At the age of 15 months, babies are given an MMR, which is a measles, mumps, and rubella vaccine. And this vaccine is highly effective in providing long lasting immunity to these viruses. Such treatment as aspirin for fevers and lotion for itching is given to the patient for comfort. Rubella, or German measles, produces a rash on the face and may be spread to the trunk and the limbs. It's only serious when it affects women in early stages of pregnancy because it can cause birth defects. The vaccines for rubella are highly effective and are usually given to most infants at the age of 15 months. The incubation period and treatment are about the same for measles and mumps. The Epstein-Barr and West Nile virus are infections that are common. Well, not West Nile virus, but the Epstein-Barr virus is, or otherwise known as infectious mononucleosis, is common, and some people may know of mono, which is the kissing disease, and the West Nile virus is actually a seasonal disease that is transmitted through mosquitoes. Polio, or poliomyelitis, attacks the central nervous system and can cause severe paralysis. And since the discovery of vaccine for this virus in the 50s, there have been very few cases. The most common used vaccine is the OPV, which is the oral poliovirus vaccine. This contains the live harmless virus. An OPV is given orally to children at the ages of 2, 4, and 18 months, and at age 5, a booster dose is given. An IPV, or inactivated polio vaccine, is a vaccine given by injection and contains the dead virus. IPV is not used as much as OPV. Chickenpox is very common and contagious in children. It produces a characteristic pock-like rash and fever, and is usually spread through airborne droplets. The poxes are caused by the varicella zoster virus. This virus can lay dormant in the nerve tissue and may cause herpes zoster or shingles later in life. The contagious periods are 2 to 4 days before the fever and 5 days after. The recommended vaccine for the chickenpox is the varicella virus. Cold and flu are common types of diseases caused by a virus. The treatments for the common cold and influenza virus includes treatments for fever, upset stomach, headaches, and body aches. Colds are spread through airborne droplets and contact with contaminated objects or hand-to-hand contact. It is highly recommended that the elderly and medically compromised get an anti-influenza virus or an anti-influenza vaccine. The flu is a disease in which vaccines are successful in 60% of patients who get them. Um, Flus are usually contagious 12 to 72 hours after symptoms appear and are spread through airborne droplets. Just like a cold, um, antibiotics do not do anything for flu because they are viruses. Antibiotics do not cure or are not treatments that are used for viruses. The swine flu evolved from a form of viruses found in pigs. H1N1 type A is the most of concern because it has evolved into other forms. The book says that it is not able to be prevented with a flu shot, although more recently there is an H1N1 flu shot. I know because I just got one. And again, it's highly recommended that people who are medically compromised or elderly get anti-influenza vaccines. Ebola is spread through bodily fluids or infected people. It is a very serious virus that is usually fatal. Quick dental check. So, what is the name of a virus that is oftenly seasonal and spread through the bite of a mosquito? If you guessed West Nile virus, you're correct. So, good job. Moving on. So there is also herpes, and there are two types of herpes viruses. There is herpes simplex virus, or the HSV1, and the herpes simplex virus 2, or the HSV2. HSV1 is usually associated with infections of the lip, mouth, and face, where HSV2 is associated with infections in the genital area. Um, HSV2 is also known to be found in the oral cavity. It is important for the dental assistant to be familiar with infectious diseases and disorders for the protection of the patient and themselves. Herpes simplex, viral hepatitis, HIV, and AIDS are all conditions that are high risk. Herpes simplex virus 1 and 2 are extremely contagious, and they are spread by direct contact with the vesicle, which is a fluid-filled lesion, or are come into contact with the fluid from these lesions. The treatment of HSV1 depends on the type, the site, and the severity. Dental teams may reschedule a patient if sores are apparent. And this can either be because of patient comfort, but there are some offices that have specific policies where they will ask a patient to reschedule. And it's not only for the patient comfort, but also to protect the dental professionals, or the people in the dental team, as herpes HSV1 can be contagious. There are many treatments that are readily available for this type of condition. Hepatitis and HIV are bloodborne diseases. Hepatitis B specifically is a blood-borne disease, and we'll go over what hepatitis A and C are. And then also the HIV, which is a human immunodeficiency virus. Um, People in late stages of HIV can develop brain damage, and dementia can occur with them. And if it is not taken care of or not treated properly, it may develop into acquired immune deficiency syndrome, also known as AIDS. There is currently no cure for AIDS or HIV, although there is much research being done to find one. These diseases are contracted directly through blood contaminated body fluids. Dental assistants are, well, the dental assistant is at risk because they often treat people that are considered higher risk behavior. These people are people that have injuries or sticks with sharp objects contaminated with blood or body fluid. These are people that also have multiple sexual partners or unprotected sex. They might share contaminated needles or have an exposure to a non-intact skin or open wound with contaminated blood or body fluid. And the dental assistant should have knowledge and understanding of the ways of acquiring hepatitis B, HIV, and AIDS. Viral hepatitis are include hepatitis A and hepatitis E. So we went over what bloodborne hepatitis is, which was also known as serum hepatitis or hepatitis B. In this case, hepatitis A and E are transmitted by personal contact or ingestion of contaminated food or water. Vaccine and boosters are available for children in areas that are of high risk. So it's hepatitis B that's a major dental concern, and you'll often be asked to get a hepatitis B vaccine before entering the dental field. Um, it's a major dental concern because it's transmitted mainly through needles and syringes. Um, it may or may not have symptoms, but the symptoms that do appear include loss of appetite, abnormal pain and tenderness, fever, weakness, muscle pain, and jaundice. Hepatitis B is commonly called serum hepatitis. The incubation period for hepatitis B is from anywhere from 50 to 180 days. And the two vaccines that have been effective against hepatitis B are something called Recombivax HB and Energix B. Both vaccines are given in a series of 3 injections. Okay, so a dental check for dental assistants at risk. What disease are the DA at risk for if accidentally stuck with a contaminated needle? They are hepatitis B, HIV, and AIDS. A pandemic, we all know what that is, don't we? So, a pandemic is a widespread infectious disease. And when I say widespread, I mean worldwide. Some examples of pandemics that have happened in the past are smallpox, tuberculosis, HIV and AIDS in the 80s. And then, of course, we all know COVID-19 is another pandemic. An epidemic is a quick spread of disease to a large group of people, but not necessarily worldwide. And in the early 2000s, we had an outbreak of SARS in certain countries, which is an example of an epidemic. um, just for your knowledge, the common cold and flus are also epidemics. Or actually, they're actually known as endemics because they're always going to be around. Um, And the pandemic is a disease outbreak that occurs when a disease effects are more than expected. So there are ways the body uses to fight disease. Our bodies repel repel thousands of infections that are coming our way every day. And how the body resists disease include infection, fever, inflammation, immunity, and antigens. And we'll go over each one. An infection happens when a full-fledged immune response is needed to fight off certain microorganisms. When this happens, the body is building a dam around the affected area called the pyogenic membrane. This membrane is a wall that contains the infection and does not allow it to spread to other parts of the body. If the pathogen overcomes the body's first and second line of defense, the infection spreads to adjoining tissues and finally to the entire body. When this happens, the body utilizes its final defenses, which are antibodies. An antibody produces immunity against a foreign substance or pathogen. There are a number of antibody groups that perform different functions in response to antigens. For example, an antitoxin neutralizes the toxins given off by certain bacteria. A fever is a type of immune response that fights off infection or pathogen. And that is because few bacteria can survive beyond the 102 degrees Fahrenheit, which is usually considered a mid to high range fever. Inflammation is another response to infection in which there is an increase in blood vessels to the specific area that allows antibodies to enter. This is usually characterized by an erythema, which is a redness of skin, and it usually produces heat and pain and swelling. And immunity is the ability to resist disease. And part of the natural immunity is inflammation and blood phagocytes. When humans are exposed to a pathogen, they will develop acquired immunity. When an antibody from another person or animal is injected into an individual, it is called passive acquired immunity. Um, Active acquired immunity is preferred over passive acquired immunity. There are two types of active acquired immunity: natural acquired immunity, which is when a person has a disease and the body builds antibodies to the disease as the person recovers. Then, normally, the person is immune to the disease. Artificial acquired immunity is when an individual is vaccinated with a specific antigen. The antigen is weakened, or the antigen is a weakened state of the pathogen or the disease. The vaccination increases the body's resistance to that particular type of disease. An antigen is a substance injected into the body to stimulate specific antibodies. When given an antigen, the body may overreact. In this case, if there is an allergic response, when given an antigen, it is called an allergen. Some individuals are more sensitive to certain allergens and are considered hypersensitive. If an individual is severely sensitive to an antigen, the body will secrete a great amount of histamines. This type of reaction is called an anaphylactic shock, and it can be fatal because sometimes it causes a person's throat to swell, for example, which can cut off their airway, and a person can die that way. So that's why it's really important to go through the patient's health history, just to make sure that they're not allergic to something that you might be using throughout the dental appointment. So our last dental check has to do with disease resistance. So what are the signs of inflammation? They are redness, swelling, heat, and pain. All right, that concludes the lecture for chapter 10. If you have any questions, feel free to shoot me an email or ask me in class. Thanks for listening.